Welcome back to Toledo Clinic TV. Our guest for this segment is Dr. Daniel Murtagh, and he is a urologist. And we'd like to spend the next few minutes talking about minimally invasive procedures that can help people who have some what would be considered more of the common urology issues.
Right. So in my world, I deal with things like overactive bladder. A lot of women have this issue, and also urgency and urge incontinence, where they might not be able to make it to the bathroom in time. So a lot of times when we have an issue, what do? We treat it with medications, throw medications at it and just try to control your symptoms. This is a quality of life issue. We don't have cancer, but we want to improve your quality of life. And not everybody, A, likes to take medications, and B, tolerates them. Sometimes medications produce side effects that are uncomfortable or unpleasant. So there's also other options that I want people to know about, minimally invasive surgical options that can either get you off medications that you're not tolerating or aren't working, or if you just don't like to take medications, get off a pill. We have a lot of options. So for overactive bladder, there are a couple different options if medications aren't your thing. You can either do physical therapy, where pelvic floor physical therapy is a new technique where you can learn how to relax the muscles of your pelvis to help with urgency. And it's recommended by the AUA guidelines as well as a first-line treatment option along with medications. If that doesn't work for you, there's other options where we would use things like scope procedures to go in and actually put Botox in the back of the bladder. Just like women use it to, smooth out their foreheads, you can also use it to smooth out your bladder, make your bladder look 20 years younger. So it's a simple scope procedure where you go in, inject into the back of the bladder, and it does the same things as the medications, but you don't have to take the pills. And it lasts for up to 9 months to 12 months. Now you do have to have it repeated. However, most people, when it works, are really happy with it. If you'd rather have something that's a little bit more permanent, there's a minimally invasive option called neurostimulation or InterStim, which is a tiny battery pack that goes underneath the skin above the buttocks, and it actually has a probe in it that helps stimulate some of the nerves into the bladder and calms the bladder down. Does the same thing as the medications or the Botox, and this is something that we would implant, and it lasts for up to 5 to 10 years. So you may have to go through a couple procedures to make sure it works and then implant it, and then if that works for you, it's a great option for a lot of people.
Okay, let's talk about BPH.
Great. For the men, okay? Enlarged prostates is what we're dealing with, or benign prostatic hyperplasia. The prostate sits underneath the bladder like a donut, and the bladder has to drain through the middle of it. So the reason that a lot of men get these symptoms, such as frequency and urgency, or difficulty starting their stream, is because that prostate gets large and that donut hole shrinks. So the bladder has to drain through high resistance and squeeze really hard. So the prostate's driving the symptoms in the bladder. So what do? We have to relax the prostate. And a lot of men go on medications, the most common being Flomax or tamsulosin. What that does is it relaxes the muscle fibers of the prostate, allowing the bladder to drain easier through it. Now, again, if medications aren't your thing, or you have side effects, usually being dizziness, or there's some sexual side effects, such as decreased libido and things like that, that men don't like to take these. Or if the medication fails and you're still having symptoms, there's minimally invasive surgical options that are available to men. When we kind of go through the thought process, we can use scope procedures and band open the prostate tissue, allowing that outflow channel to be larger, thus allowing the bladder to drain easier. Those bands are called a urolift procedure, minimally invasive, and the nice thing is that it's the next step up from medications.
Is it permanent?
It can be permanent, and you can repeat it, but it lasts for quite a long time. The results, the improvement of those symptoms are lasting between 5 and 10 years, so it's really impressive. And the best thing is that you don't need a catheter afterwards. So men can come in, have the procedure, and leave and stop taking the medications. Sometimes, if the prostate is too large or there's anatomical characteristics of the prostate where a urolift procedure might not be appropriate. There's things like lasers or resection that we can do with scopes as well to open up that outflow channel, thus allowing the bladder to drain easier and relieving the symptoms.
Okay, one final topic, erectile dysfunction. There are obviously medications that men can take, but that might not always be an option or
Correct.
wanted.
So with erectile dysfunction, it's always something that we want to help that healthy sexual relationship later in life is when it usually affects men. Medications is something that we always start with to see if that works. If it doesn't, or of course men don't like to take the medications, there's other things we can do. Sometimes it's difficult, but injections can be helpful. There's vacuum pumps, but there's also something called a penile prosthesis, which is an implantable device that allows men to achieve erections. It usually requires a stay in the hospital. However, the device will last between 8 and 10 years is what we expect it to. And so when we implant it and it works, men are very happy with it.
So good to know that there are other options when medications maybe are not something that's going to work for every patient.
Absolutely.
All right, good. Thank you for that information. We
Yeah.
appreciate it.
Thanks for having me.
All right, we'll be right back.